Good evening, everyone. My name is Shanti Terpadisamy and I will be the moderator. Miss Irene will be the speaker 1, Miss Wawa will be the speaker 2, and Miss Ain will be the speaker 3. Today, we will discuss about the social media and mental health issues in Malaysia. We depend on our smartphones for work, school, our personal and social life. When was the last time you left home without your phone and keep on going? The internet has become a significant part of our daily life, so too as social media, and it is having an impact on today's teens. Back in 2005, when social media was still in its infancy, only about 5% of users in the United States were involved in social media. In 2019, the number grew about 70%. Using social media has become its positive, the good, its cautionary tales, the bad and the danger, the ugly, the lurk and impact the life of many, but especially teens. Now we will explain about the issues. So our forum members are people who have been experiencing mental health difficulties and also have been at them at some point of their life. Miss Irene, can you share with us about the good of social media and mental health issues in Malaysia?
Hi everyone, my name is Irene and I'm speaker 1. Thank you Santi for asking me this question. So around the globe, billions of people are using social media nowadays. So fundamentally changing the way that we communicate with one another and has transformed the way that we meet and also maintain our relationship. Not only it is a great tool for people who are looking to share their views and also meet like-minded people with similar interests, social media also provides us with the opportunity to stay in touch with people from all around the world. Social media has also created opportunities for people who would otherwise never seen each other to stay in touch and also nurture their relationship. So currently the average user now spend about 2 hours and 16 minutes each day on their social media platforms. The World Social Media Day is on Sunday 30 June and are recognizing and also celebrating social media's influence on global communication and technology. While social media has also provided us with access to more information than ever before, there are both positive and also negative implications of our use of this technology today. For some people, it's not uncommon to feel reluctant to talk to family and friends about their health concern. So with so many health services available online today, social media provides a safe space where anyone can ask questions and access a lot of health resources. From countless health forums to free online counseling, there are many online services available to support people with questions or concerns. Social media has introduced countless methods of communication and also information sharing to normalize help-seeking behavior. So for those who are living in rural area, social media is also an inexpensive and also accessible help-seeking option for them, offering a wide range of resources to those who may not otherwise to access to these resources. That's all from me. Thank you.
That's really a good point of view from you, Miss Irene. Thank you. I also believe that social media and technology offer us a greater convenience and connectivity. Along with the good comes the bad. Let's ask Miss Wawa about the bad side of social media. Miss Wawa, what is your opinion about bad of social media and mental health issues in Malaysia?
Thank you, Santi. As we know, social media gives a lot of positive impacts to us as stated by Ms. Irene previously. While on the other hand, although social media is extremely beneficial in several ways, social media does have the negative impacts including issues like increased level of depression and anxiety, poor sleep quality, dissatisfaction with body image, cyberbullying, fear of missing out, and else. Nowadays, social media is important and constantly surround us. People are always on their phones or laptops for updating status, posting pictures, liking things, and messaging with friends, communicate with people. We know that social media has becoming a relatively new introduction to our society. The effects range from changing relationship to changing mental health status and suicide risk. The number of users are increasing every year, and being that 18% of those teenagers, we are starting to see more youth population facing with mental health disorders. Social media has become a new cause for harassment and suicide unless we become more educated on the issue and how we can help the youth. The problem continues to spread. More research and investigation needs to be done on this growing social media outbreak to truly understand the adverse effects and find ways to prevent and treat it. By overuse to social media, people will become addictive to the social media and can disturb personal lives as well. The teenagers are the most affected by the addiction of the social media. They will get involved very extensively and are eventually cut off from the society. A person can turn themselves from extrovert to introvert when they are not too exposed to the outside and would rather spend most of their time scrolling social media than going outside doing productive things such as doing sports and else. This can waste individual time that could have been filled by productive tasks and activities. Nevertheless, by using the social media, people tend to get depression and anxiety. Human beings need face-to-face relationship to be mentally healthy. Nothing reduces stress and boosts your mood faster or more effectively than eye-to-eye contact with someone who cares about you. The more you prioritize social media interaction over in-person relationship, the more you are at risk for developing anxiety and depression. Online platforms may also have the potential to affect our self-esteem and damage mental well-being through promoting unreasonable expectations. Social media has been linked to poor self-esteem and self-image through the advent of image manipulation on photo-sharing platforms. In particular, the notion of the idealized body image has arguably been detrimental to self-esteem and image, especially that of young women. The 24/7 circulation of easily viewable manipulated image promoting and fulfilling unrealistic expectation of how young people should look and behave. In conclusion, there are many ways that social media can affect our mental health because today technology is a very large part of our lives. I believe that people need to pay more attention to how much time they are spending on these sites. It seems as though many of these issues directly related to the overuse of social media, so for our families, friends, and ourselves, it is important that we become more aware of these effects so we can prevent them. That's all from me. Thank you.
Thank you, Miss Wawa, for your explanation. It really makes sense. The most time you spend on social media may lead to cyberbullying, social anxiety, depression, and exposure to content that is not age appropriate. Sadly, there is an ugly side to all that technology offers. Miss Ain, can you share with us the ugly side of the social media and mental health issues in Malaysia?
Hi everyone, and thanks to Santi for asking me a question. So, in my opinion, there is an ugly side of using social media, which it leads to cyberbullying and online harassment, setting and depression. Basically, we only hear about students or teenagers that have been bullied, but social media and technology have brought bullying into the next level, which is we call it cyberbullying. Cyberbullying can be defined as using digital media to communicate false, embarrassing, or spread the fake news about other person. According to stopbullying.gov, 1 out of 4 teens has been bullied mentally and physically, while up to 43% also have been bullied on social media or cyberbullying. Cyberbullying can occur through SMS, text and app or online in social media, forum or gaming, where people can view, participate in or share content. Cyberbullying includes sending, posting or sharing negative, harmful, false or mean content about someone else. It can include sharing personal or private information about someone else and can causing embarrassment or humiliation. Some cyberbullying cross the line into unlawful or criminal behavior. On the other hand, cyberbullying is quite common, can occur to any young person online and can cause profound psychosocial outcome, including depression, anxiety, and also can lead to the suicide. Next is setting. Setting can be defined as sending, receiving, or forwarding sexual message, pornography, or image via handphone, computer, or other digital device. Then the ugly side of using social media is can cause individual to suffer from depression. Depression that develop when preteen and teens spend a great deal of time on social media sites such as Facebook, Twitter, and so on. And then it begins to exhibit classic symptoms of depression. So, as a parents, there are things that we can do to improve our children's life online or in real life. Parents should set boundaries right away when you give your child their first phone. Set parental control on his or her phone with access to their password. Have conversation with your children on why some things should be kept private. Technology has changed the way we live, work, and socialize, but it can replace parenting. So, I think as a parent, we should give advice and take a good care of our children to prevent the cyberbullying from happening to our children. So, I think that that's all from me. Thank you.
Thank you, Miss Ain. Your opinion is really correct. Statistics show that every 7 minutes a child is bullied. Unfortunately, intervention is rare with an adult intervention is only 4% and peer in 11%. 85% of the case of bullying are not stated. Sadly, this can take a toll on young minds. Suicide remains among the leading cause of death of children under age of 14. I believe that parents should set boundaries right away when they give the child their first phone. Set parental control on their phone and be aware of privacy concern and cyber security issues. Technology has changed the way we live, work, and socialize, but it can't replace parenting. Social media had its good, bad, and ugly, so we should know how we use it. Thanks to all the speakers to give their best opinions. Thank you.